Hello students, our today's topic is the biology of the radiation. The first we are going to discuss is the direct versus indirect ionization. As we know that direct or the indirect ionization, they will cause the cell damage. The direct ionization, it occurs when the charge particles like electron, so the electron with the sufficient kinetic energy, it interacts with the cellular atom or molecules to create free radical. So this process is known as direct because the interaction it occurs directly between a particle and a cellular component without any intermediary step. The charged particle can continue interacting with other molecules until all its kinetic energy is lost. Whereas the indirect ionization it occurs when the non-charged particles like photon they react with the cellular water. So the energy absorbed by the water molecule it will form ion pair and form hydroxyl radical. So these free radicals will interact with the cellular atoms and molecules, damaging the cellular protein. So this process is indirect because why? Because of the intermediate step of the hydrogen based free radical formation. So in the indirect ionization, what you will see is the photon they will react with the cellular water. So the energy absorbed by that water molecule will form ion pairs. So these free radicals will interact with the cellular atom, so damaging the cellular proteins. So that is why it is known as the indirect ionization. Remember, about two-thirds of the radiation-induced biologic damage it results from the indirect effect. The biological effects are of two types. One is the deterministic effect and other is stochastic effect. What is deterministic effect? The deterministic effect, they are also known as non-stochastic effect. So the deterministic effect will depend upon the time of the exposure, dose and type of the radiation. So it has a threshold of the dose below which the effect does not occur. The deterministic effect are those in which if the dose is increased, the severity of the effect that will increase. So the mechanism involves effect on many cells. In these, the severity of response it is proportional to the dose. These are cell killing occur in all people when the dose is larger enough. The deterministic effect will include the acute radiation sickness and chronic radiation sickness. The acute radiation effect it is not dangerous and they are mainly caused when the radiation dose must be large and dose that has been delivered in very short time. So these effect causes just after the exposure or within the 24 hours to the exposure. Mainly nausea, vomiting, headache, fever, skin and tissue burns, they are included in the acute radiation sickness. The chronic radiation sickness, it occurs after a month or year of taking exposure in high amount. So these effects, they are dangerous and may lead to death. So these are not immediate observable effect and they may result in long-term effect like cataract, cancer, genetic mutation. It is some example of the chronic effect. What is stochastic effect? The stochastic effect is those effect which occurs when the person receives a high dose of radiation. So these effects will have increased probability of occurrence with increased dose. Likewise, in the as in deterministic when effect where there was a threshold of dose below which the effect does not occur, whereas in the stochastic effect there is no threshold dose below which is creatively certain that stochastic effect cannot occur. So the severity will not depend upon the magnitude of the absorbed dose. So these occurs by chance, usually without threshold level of dose, have no level of radiation dose. So in the stochastic effect, the malignant diseases and the heritable effect for which the probability of effect occurs. So the stochastic effect can be of two types, either somatic or genetic. So this table is important. This one is the deterministic effect and this one is the stochastic effect. The deterministic effect occurs due to the cell killing. They have a dose threshold typically. They are specific. The deterministic effect, they are specific to particular tissue. The severity of harm, it is dose dependent, whereas the stochastic effect, it is due to the cell changes and proliferation toward a malignant disease. It is not dose dependent. There is no dose threshold applicable, also to very small dose. So the example of the stochastic effect are the leukemia, thyroid cancer, salivary gland tumors, and heritable disorders. Whereas the deterministic effect examples are xerostomia, osteoradionecrosis, cataract, etc. Now let us discuss the changes in the biological molecules. So what can radiation do to the nucleic acid? It can the radiation produces a number of different type of alteration in the DNA. It can cause breakage of one or both the strand of the DNA, or there can be cross-linking of DNA strands within the helix, or there could be change of loss or base, or there could be the disruption of the hydrogen bonds between the DNA strands. So what are the most common type of the damages? They are the single and the double strand breakage. The nucleus is more radiosensitive than the cytoplasm. The most sensitive site in the nucleus, it is the DNA within the chromosomes. As we know that the chromosomes, they serve as usual marker for the radiation injury. So if the radiation exposure occurs after the DNA synthesis, that is in late S or G2 phase, what you will see, only one arm of the affected chromosome is broken. However, if the radiation induced breakage occur before the DNA has replicated, that is in the G1 or early S phase, the damage is seen in the damage is seen as break in the both the arms. The radiation effect occur in the cellular structure. At the dose of 30 to 50 gyre, the mitochondria demonstrate increased permeability, swelling, and what you will see is that there will be disorganization of the internal cristae. What is a bystander effect? Bystander effect are the cells that are damaged by the radiation release. They will kill the nearby cells. So that is known as bystander effect. So this bystander effect can cause chromosome aberration, cell killing, gene mutation, and carcinogenesis. Remember, the damage to both the strand of DNA at the same site, it is usually lethal to the cell. The human cells, they can be divided, they can be subcategorized according to the radio sensitivity into the 5 categories. The first is the most radiosensitive. Which cells are the most radiosensitive? They are the vegetative intermitotic cells. Why they are most radiosensitive? Because they divide regularly, they have a long mitotic figures, and they don't undergo differentiation. The example of the vegetative intermitotic cells, they are the early precursor cells, those in the spermatogenetic or hydroblastic series, and the basal cells of the oral mucous membrane. The second category is differentiating intermitotic cells. They are less radiosensitive than vegetative intermitotic cells as they divide less often. So, the example of this class includes the replicating cells of the inner enamel epithelium of the developing teeth, cells of the hematopoietic series, spermatocytes, and oocytes. The thirds are the multipotent connective tissue. They have intermediate radiosensitivity. Example are the endothelial cells, fibroblast, and the mesenchymal cells. The fourth category is of reverting post-mitotic cells. They are generally radio-resistant because they divide infrequently. What are the example of the radio-resistant cells? They are the acinar and ductal cells of salivary glands and pancreas, as well as the parenchymal cells of liver, kidney, and thyroid. What are the most radio-resistant cells? They are the fixed post-mitotic cells. They are Once they are mature, they are incapable of division. The examples are the neurons, striated muscles, squamous epithelial cells that have differentiated. So you can get a question, which cells are most radio resistant? The answer is the neurons, striated muscle cells. So this table is very important. Based upon the radio sensitivity, we can categorize into high, intermediate, and low radio sensitivity level. The example of high radio sensitivity are the spermatogenetic and erythroblastic stem cells, basal cells of oral mucous membrane. The intermediate radio sensitivity cells are vascular endothelial cells, fibroblast, parenchymal cells of liver, kidney, thyroid, acinar and ductal salivary gland cells. Whereas the low radio sensitivity or the radio resistant cells, they are the neurons, striated muscle cells, squamous epithelial cells, and the erythrocytes. So this table will show the relative radio sensitivity of various organs. The organs which are highly radiosensitive are the lymphoids, organs, bone marrow, intestine, testes, and mucous membrane. Whereas the low radiosensitive cells, they are optic lens and muscles. Now suppose a patient receive a radiation therapy. What are the effects we can see? We can see if the short term effects or the long term effects. What are the short term effect? The short term effect of a radiation on the tissue, they are generally seen in the first days or week after the exposure. So they are determined primarily by the sensitivity of the parenchymal cells. Whereas the long term effects of the radiation, they are seen a month or year after the exposure, where you will see the loss of the parenchymal cells and the replacement with the fibrous connective tissue. So the changes, they are caused by reproductive death of the replicating cells and by damage of the fine vascular structure. So that will impair the transport of the oxygen, nutrients, and waste products that would cause the cell death. So both the radio sensitive and the radio resistance parenchymal cells, they are replaced by the fibrous connective tissue. Now let us discuss the response of cells, tissues, and organ it will depend to the radiation depends upon the exposure condition. What are the modifying factors? The first is the dose. The severity of the deterministic damage that is seen in the irradiated tissues that will be dependent upon the amount of the radiation received. So you will see that in all individual receiving dose above the threshold level, the amount of the damage it is directly proportional to the dose. So higher the amount of the dose, higher will be the amount of the damage. Second is the dose rate. What is dose rate? The dose rate indicates the rate of exposure. Like in a radiation, you want to give a radiation to the patient. So you can either give the rays into multiple small dose, or you can provide a single large dose. So remember, the multiple small dose that will provide a greater tissue destruction than with a single large dose. So this is the dose rate. Remember, the exposure of the biological system to given dose at high dose rate that would cause more damage than exposure to the same total dose that is given at lower dose rate. So when the organisms they are exposed at lower dose rate, there is greater opportunity for the repair of the damaged structure. Second factor is the oxygen. The radio resistance of many systems, it increases by a factor of 2 or 3 when the exposure is made with the reduced oxygen. So that is why hyperbaric oxygen therapy may be used during the radiation therapy of the tumor having hypoxic cell. Second is the linear energy transfer. The higher linear energy transfer radiation, like the alpha particles, they are more efficient in damaging biological system because of their high ionization density than as compared to the X-rays, in order to induce double strand breakage in the DNA. Whereas the low linear energy transfer radiations like the X-ray, they are more likely to cause single strand breakage, and they causes less biological damage. Now let us discuss the way the radiation effect on the tissues. So what is the most common source of the gamma rays? It is the cobalt. Small implant containing radon or iodine 125, they are directly placed in the tumor mass. So such implants they can deliver a high dose of radiation. Now what are the effects of the radiation on the oral mucous membrane? The oral mucous membrane, they have a basal layer that is composed of rapidly dividing radiosensitive cells. So at the end of the second week, the mucous membrane begins to show area of redness and inflammation. That is the terminology here is mucositis. So there would be formation of white to yellow pseudomembrane. So at the end of therapy, the mucositis, it is most severe. Apart from that, Candida albicans is the most common complication that could occur and may require treatment. After irradiation therapy is complete, the mucosa begins to heal rapidly. The healing usually complete by 2 months. Later, the mucous membrane tends to become atrophic, thin, and avascular. So these changes can complicate the denture wearing that may cause oral ulceration of the compromised tissue. What happens to the taste bud during the exposure to the radiation? The patient can notice a loss of taste sensitivity during the second or third week of radiotherapy. So for entrance exam, remember the loss of taste sensation is seen during the second or third week of the radiotherapy. The bitter and acid flavors, they are more severely affected when the posterior two-thirds of tongue is irradiated, and when anterior one-third of the tongue is irradiated, then the salt and the sweet taste are affected. The taste loss is reversible. And how much recovery does it take place? It takes place around 60 to 120 days. What happens to the salivary glands? Remember the parenchymal component of the salivary gland, it is radiosensitive. The parotid gland are more radiosensitive than the submandibular and the sublingual. So what patient feel is loss of the salivary secretions during the first week after the initiation of the radiotherapy. So this reduced flow of the saliva is dose dependent, and it reaches 0 at 60 gyre. Remember, the mouth becomes dry at 60 gyre and may show xerostomia. Swallowing is difficult, swallowing is painful. Patient may feel difficulty with chewing, swallowing. The serous cells, they are more radiosensitive than the mucous cell. So the gland will demonstrate progressive fibrosis, loss of fine vasculature, and the parenchymal degeneration. What would happen to the teeth if the exposure is given before calcification? You will see the irradiation can destroy the tooth buds. But if the irradiation is given after the calcification has begun, that may cause cellular differentiation, causing the malformation in the teeth that may retard the root formation. So remember, the radiation, it has no effect on the crystalline structure of the enamel, dentine or the cementum, and radiation does not increase their solubility. What is radiation caries? Radiation caries, it is a rampant form of dental caries that occurs in patients who receive a course of radiotherapy. The patient receiving radiotherapy to oral structures will have increase in the microorganisms like S. mutans, lactobacillus and candida. These caries result from change in the salivary glands, saliva, as there is reduced flow, decreased pH and reduced the buffering capacity, so increase in the viscosity and thus altering the microflora. Three types of radiation caries exist. The most common attack is on the superficial lesion attacking the buccal mucosa, occlusion surface, incisal and the palatal surface. Another type involves the cementum and dentine in the cervical region. What is the best method of reducing radiation caries? It is the daily application for 5 minutes of viscous topical 1% sodium, 1% neutral sodium fluoride gel. So use of 1% sodium fluoride gel in custom made trays. It is the best method of reducing the radiation caries. Now, what is the effect of radiation on the bone? So the primary damage to the mature bone, it results from the radiation induced damage to the vasculature of the periosteum and the cortical bone. Radiation act by destroying the osteoblast and the osteoclast. So the marrow, it will become hypovascular, hypoxic and hypocellular. There will be lack of osteoblastic and osteoclastic activity. The terminology we use is the osteoradionecrosis. So there will be decreased vascularity of the mandible, and you may say bone infection. So this infection may cause a non-healing wound that is difficult to treat. That is more common in the mandible than in the maxilla because of the richer supply to the maxilla. The higher the radiation dose, the greater is the risk for osteoradionecrosis. When the whole body it is exposed to low or moderate dose, the change it is known as acute radiation syndrome. So during first minute to hours after the exposure of the whole body radiation of about 1.5 gyre, you will see GIT tract disturbances. The individual may develop nausea, vomiting, diarrhea, weakness, etc. The whole body exposure of 2 to 7 gyre will cause injury to the hematopoietic stem cells of the bone marrow and the spleen. In range of whole body exposure in range of 7 to 15 gyre will cause extensive damage to the GIT system. That is known as gastrointestinal syndrome. Exposure in excess of 50 gyre will affect the cardiovascular and the central nervous system. That may cause the embryo and the fetus, they are more radiosensitive than the adults because the embryonic cells, they are undifferentiated and rapidly mitotic. Remember, the most sensitive period for inducing developmental abnormalities in during period of organogenesis is between 18 and 14 days of gestation. Irradiation during the fetal period more than 15 days after the conception does not cause gross malformation. So this table is important, showing the susceptibility of the different tissue to the radiation induced cancer. The colon, stomach, lung, bone marrow, they have higher susceptibility, whereas the liver, thyroid, skin, brain, salivary glands, they have low susceptibility.